the area of global health security these days, and it's nice to work with everybody because global health security involves getting everybody, even the community person, veterinarians, environmental health specialists, all to be involved in the concept of public health. So I'm excited that now we have the fourth, is it the fourth estate, you call it, journalists to be part of the global health security drive. So for me, this is a very, very important session. Thank you. So I think we would go ahead straight away into the presentation. Let me put up my camera in order to stop my video in order to make sure that the signal strength is good. After I would open my video. All right. So our session today is on health communication and infectious diseases. And don't worry, if you have any questions, we would just note them down. As I do the presentation, I will give breaks where we would actually look at we will listen to your questions for explanation. So our objectives today is to take you through this training, largely to prepare you to be able to prepare and disseminate messages on advocacy and public health, because the world now, in terms of health or public health work, everybody is a public health agent. We want to be able to help you to prepare and disseminate messages, also on economic opportunities and access to credit. And then also have new and responsible ways of communicating and raising awareness, especially of infectious diseases to the citizenry. The guiding principles of this training session will be mainly to ensure accuracy and evidence-based reporting. In science, we believe in evidence-based work. If you don't have the evidence, please don't say it, because whatever you say should be replicable, or it should be evidence-based, such that if anybody else is looking for it, they can find the same information. We want to be able to present clarity of information and make that information accessible in clear and understandable language to the general public. As we present our information, we also want to be sensitive and empathize with our listeners. Okay, sometimes we're in a hurry to break news without necessarily being empathetic of the people that the news affects. We want to be able to empower ourselves with a lot of knowledge, because empowerment is, or makes sure that once we are in charge and we know what we are doing. And also want to be socially responsible to promote public health and to contribute to a healthier society. At the end of this session, what do we want to have achieved? Okay, we want everyone in the room to go away knowing the importance of health communication in promoting public health, knowing how to effectively communicate complex health information to different audiences. We want everybody leaving the room to be able to conduct interviews with health experts. You know, it's always a very thorny issue. And as we go along, we'll talk about some of the sensitive issues that happen when you have to interview some of the health experts. I know people have had all sorts of experiences with health directors from various parts of the country, and sometimes it's not exciting. We want to be able to address some of the issues here. We want to be able to address sensitive health issues with accuracy and empathy, identify and combat misinformation and disinformation related to health topics, and also to be able to produce impactful multimedia content that promotes health literacy. Let's start, first of all, looking at the fundamentals of health communication. Okay, health communication really is a multidisciplinary field, and it focuses more on using communication strategies to promote health and well-being among individuals and populations. It is a critical aspect of public health because it involves the dissemination of health-related information with an aim to influence. So we are not just disseminating information for disseminating it, but we want to be able to get the information to influence individuals and communities, okay, so that they can take the right decisions, do the right actions, or even adopt the right policies to improve their health, okay? And it involves how we share health information, whether it's through public campaigns, whether it's through one-on-one information sharing, whether it's through mass education. At the end of the day, we want accurate and well thought of information being disseminated to the listeners, who then will be able to take the right decisions. The main goals of health communication largely are to increase awareness and knowledge, influence behavior and attitudes towards health, demonstrate for the listeners to adopt a way to demonstrate healthy practices, advocate for health policies, and also improve provider information, provider communication. This is very, very important. Effective health communication can lead to better health outcomes by influencing health literacy and encouraging positive health behavior. So at the end of the day, if you look at the definition of health communication, we want to be able to get our listeners to take the right decisions that influence their health. What are the principles of health communication? First of all, we must be able to understand our audience. Remember that our audience come from diverse demographics and diverse backgrounds. If we do not share the information in the way that, as is said, a class 1 child or a class 2 pupil would understand, we are defeating the purpose, because misinterpretation of the information we share will then arise. Our audience's ability to understand health information must be taken into consideration, okay? And then we must also be able to understand their attitudes, their beliefs, and then their motivations that tend to affect their health behavior. Secondly, our message must be clear and effective. It must be simple, using very plain language, and avoiding complex information. Sometimes we want to use some big words to sort of impress ourselves, or impress in a bit to sort of impress the audience. But it is very important to note that in health, especially in public health, certain words do not mean the same as they mean in English language. And I'll give some examples as we go along. There are certain words you use in English which don't mean the same thing when those words are mentioned in health or public health. So we must refrain from just using words and jargons in a bit to sort of impress. Yeah. And the message that we share, okay, we must be able to tailor the message to the audience's needs and concern. And our messages should be consistent, okay, across all platforms. We must also thirdly understand the cultural sensitivity of our listeners and avoid stereotypes. A lot of times stereotypes come because of stigma, because of our understanding of certain perceptions about certain people or certain groups of people. Our language must be appropriate for the audience, especially when translation is necessary. You know, I think one of the big challenges we are having in Ghana currently is the way some of the local language media houses project stories. If you listen, so interesting, and think we are all peers, and we should all be in a mood to be able to check each other and correct each other. Other than that, what happens is that we tend to share the wrong information, especially in the area of health. Credibility and trustworthiness is also a principle of health communication. We must source information from reliable and credible sources. And these sources should be very, okay, the information transparent. There should be this about information that we are sourcing. And then also our engagement should foster trust with our audience. We cannot just share information that becomes confusing, and then later we say, oh, information that we shared was wrong. After a while, our audience will refuse to trust the news we share. There are multiple channels through which we can use to communicate. The traditional media that we are aware of. Now, social media has become the big deal. And unfortunately, social media is pushing boundaries with a lot of false information. So it becomes really, really dicey sometimes where we source our information from. Let's always do well to source information from credible sources. I have a rule of thumb when it comes to social media messaging. Any information that comes or anything that comes and says that, oh, you have to listen to this immediately before it is taken off the internet, I know that information is likely to be false, and it's somebody trying to push wrong information across. Human beings know that people have itching ears. So once they craft the message in that manner, they know that, hey, everybody will want to listen to it in a bid to misinform people. Another principle of health communication we need to be aware is the behavioral change theories, okay? And it's important that as we share our messaging, we understand how our messaging is going to affect our audiences, either through the health belief model, which focuses on perceived susceptibility, the severity, benefits, and barriers of the messaging that we are sharing, or by sharing the message, we know that they will adopt it through the social cognitive theory, where we are emphasizing the role of social influences and self-efficacy. Or our clients will go through the stages of change, okay, where they go through a staged effect, okay, in changing their behavior. At the end of the day, we want to be sure that whatever information and whatever communication we are sharing, we are mindful of these health principles or health communication principles. And then we use this to influence the people who are listening to us. After we have shared our messaging, it is always important to evaluate the message that we have sent out and to ask for feedback. I know that sometimes it may be difficult to find feedback, especially when we do monologues. I mean, you're just sharing the information, but it's always good to periodically go back to our audiences and find out, how did you perceive the message that we shared? How are we impacting you in the way we share our messaging? And then we can also have standard monitoring systems that also give us feedback on the messages that we share, the news that we communicate. Feedback loops are very, very important. That ensures continuous feedback to us once the message is sent out. And then ultimately, ethics. In every profession, there are ethics. And we all know that as journalists, we also live by ethics. We cannot do things anyhow. So we must respect autonomy. Okay. We must make sure that we are not sharing information to do harm, but rather to do good. And that's the concept of beneficence. We are not going to be involved in any form of malfeasance, okay, where we avoid doing harm because we want to misinform the people or coerce them into wrong decision making. And we want to be sure that justice prevails, okay, where our health communication efforts are equitable and accessible to everybody. With all these principles, how do we then communicate health information, especially complex health information? I want to state categorically that just communicating health information can be complex and challenging. How much more complex health information? So we need to be able to carefully understand the information before we share it. Other than that, in our bid to share the information, we will end up confusing ourselves and even confusing our audience. So how do we go about communicating complex health information effectively? It requires a strategic approach to ensure that the audience understands the context, but also they are motivated to act on it. So first of all, we'll start with the big picture in view. Okay. We present an overview of the main points before we dive into the details. Okay. This helps to set the right context. Okay. Making sure that we have a big picture, the audience has a big picture view of what the information we are sharing. And then with the big picture view, when we begin to delve into the details with clear, simple language, it becomes easy for them to understand. I talked about avoiding medical jargon or certain words, especially medical terms. So a very good example is outbreak and occurrence. Okay. So let me explain. In public health, we talk about outbreaks when it has to do with infectious diseases or contagious diseases or diseases that are easily transmissible from one person to another. And then we talk about occurrence when it comes to do with diseases that do not communicate or do not move around, that's non-communicable diseases. So I remember some years ago, maybe about some 10 years ago, there was a particular news item where somebody broke the news that there was an outbreak of hernia somewhere in the Volta region. I don't know how many of us in the room remember that story. There was it was an incident in Volta region where somebody broke the news. I mean, it was breaking news. Outbreak of hernia in Volta region. I've forgotten the district. I think it was somewhere, I think maybe around Jessica area, that area there. But hernia is not a contagious disease. And so there can never be an outbreak of hernia. What the person should have said was that there is an increased occurrence of hernia cases in this particular district. But once you use the term outbreak, you are talking about something completely different to the medical professional. And so one of the things I would suggest is that if you talk to a health professional and they are using certain words, kindly ask them to explain. It gives you a better understanding so that you can easily communicate to the layperson who's listening to you. Sometimes we use complex health professionals that very easily use complex words like myocardial infarction. What's a myocardial infarction? Simply put, it's just a heart attack. Okay, but I know my health colleagues are always bent on using big words to try to impress. Please, please always take the time to ask them to explain the concept that they are using or the word that they are using, so that you as the communicator would be able to translate the right message to the lay person listening to you. Another means through which we get to communicate complex health information is to be able to break down the information into smaller and manageable chunks, okay? Sometimes you have to use visual aids like diagrams, charts, infographics to explain these concepts, complex concepts. And you can work with the health professionals to even draft some of these infographics to make it easier to understand. Okay, sometimes you can also use some of these things to be able to relate complex ideas, okay? For instance, a very complex idea that all of us struggle with to explain is the concept of the immune system, okay? How do you explain the concept of the immune system to an ordinary person? And we always tend to use the concept of soldiers fighting or an army fighting. It is easier in that way. When you've communicated, always ask for understanding. Ask if it's possible, I mean, as much as possible, ask the audience whether they understand and let them repeat the information if possible. So that's where if we are doing a news item, because you don't have the opportunity to maybe directly ask them, our feedback loops and feedback system works very well for us, so that whoever is listening to us can be able to give us the feedback that they understand the information we have shared. And we need to be able to be patient and empathetic. Other than that, we would confuse our listeners. Any questions from the room? Any question for now? If there's no question, can we move on?
Yes. Yes.
Oh, okay. We will move on. All right. Next slide. Next. How do we interview health professionals? I know my colleague health professionals can sometimes be very, very annoying, and they want to throw their weight around, especially when it comes to dealing with reporters. But that has happened because, unlike politicians, health professionals always want to be certain of the information they communicate before they open their mouths. Unfortunately, in Ghana, we have politicians who, even when they are asleep, hello, is somebody talking?
Can you hear me?
Yes, I can hear you. Can you
please,
hear?
I have an urgent question for you. Just a minute, please.
Okay. Okay.
Hello, Doc. Thank you. This might be unrelated, but I guess it forms part of what we're here. While I was not break, I was bitten by a cheche fly. And I am seated in class and very worried because of some readings I'm doing. And what are the immediate remedies for me? The question I am sleeping.
Okay. I must confess that one tete fly bite should not give you a disease. Okay. So you just calm down. If you have a hand sanitizer, apply a little hand sanitizer to the place. It will help relieve the pain of the itch. And I don't think you should be too worried about it. If you are certain that it was a tsetse fly that bit you, because tsetse flies are quite big. Are you certain that it was a tsetse fly that bit you? Hello? Hello, any response?
Yes, you can go ahead.
Okay, all right. So just be assured that the one tsetse fly bite won't give you a disease. Your body soldiers are strong enough to take care of whatever parasites they pushed into your, even if they push anything into your body. Anyway, all right. So let's continue. So interviewing skills for health reporting. Unfortunately, we currently have a group of people, I mean, let me put it that way, politicians who, even when they are asleep and you wake them up to talk about something, they have an idea and they have an opinion and they will say something. On the contrary, health professionals do not act in that way, because for health professionals, it is important that every information they share is verified. And so if you hear something happening in a community and you call maybe a district director of health services, or you call a director, let's say director of public health at Ghana Health Service headquarters, or the regional director of health services, or the deputy director of public health, and you haven't conscientized them what you are coming to ask them, and then you suddenly put them on air and you expect them to answer your question, you would really, unfortunately, annoy them such that they would never want to talk to you again. So I would plead that, first of all, if we hear something, let's prepare. There's always the need to do preparation. Let's not be in a hurry to break health news. Breaking news in health it really doesn't help anybody. Getting your facts right always helps everybody. So you need to, if something happens, you need to verify the information. You need to talk to the people around. You need to talk to any health professionals who are working on the case at the time. Verify that whatever is going on is right. Prepare questions appropriately. Share these questions with the health professionals, and then before you interview them. Other than that, next time, they would not want to talk to you. They would avoid you. And please remember that in the health system in Ghana, there are authorities. It's not everybody who is allowed to talk to the media, whether you like it or not. If you work in the government sector, that bureaucracy and authority system exists. And so a nurse in a facility really should not be talking to the media. It is actually either the public relations officer of the facility or the medical director of the facility. In the same way, at district level, it is not a public health nurse down there who is supposed to be talking. It is either the district director of health services or the public health nurse in charge of the district. It's not even the disease control officer. So it is important that we always direct our questions to the right people. Secondly, it is important to build rapport. You cannot live in a district where there are health professionals, you don't have any engagement with them when there's nothing going wrong, and then suddenly something happens, then you go chasing them and expect them to want to talk to you. They will be afraid, they will be wary because they don't know they don't know you, they don't know what you are trying to, excuse my language, what you are trying to achieve. These days that politics has been infused into everything. Somebody is afraid of their job before they will say that because they went to say something, so some political is being politicized. So always make sure you build rapport with the health professionals in your community when everything is normal and there's nothing happening, so that on the day when something happens, it is easier for you to reach out to them and communicate with them, and they'll be willing to listen to you. So you will build the rapport, you will engage with them, you will have discussions with them. Once in a while, it is good to even come up with health topics and discuss with them without necessarily putting it on air. So once they have your confidence, anytime you reach out to them, they are happy to want to talk to you. And anytime you are interviewing a health professional, please begin the interview by explaining the purpose, be empathetic that the health topics can be sensitive. And so sometimes it's very stressful, even for the health professional to talk about it. And please pay close attention to what they are saying, because sometimes they may say something and you would end up asking them a question about the same thing they have just said. And they tend to have to repeat themselves over and over again. Nobody likes to repeat themselves. It is important to understand the sensitivity of the health topics. When we started HIV care or HIV control activities in Ghana, we used scary language. Now we have moved on away because of antiretroviral therapy, medicines that are being used to treat HIV. Truthfully, HIV now has become a chronic disease. It is no longer a fearful disease. In fact, I can tell you that in some countries, like in Southern Africa, even the young people, they want to get HIV to be seen to belong. It's, excuse my language, is that bad? Because you see large numbers of young people who have HIV. So if you don't have HIV, it's like you are the odd person out. So in our country, we still maintain scary names about certain diseases, especially in the vernacular or the local languages. Okay, so TB, for instance, who knows the tree name for TB? Anybody knows the tree name for TB? Did we hear, is anybody mentioning the tree name for TB? I can't hear you. Martin, can you unmute? Hello? Can you hear me? Am I being heard in the room? So, for instance, the tree name for TB is Nsamanwa. And that definitely is a scary name. Can you all hear me?
Yes.
Okay, good. I just want to be sure that I'm being heard and that I'm not just speaking to myself. So we want to be able to avoid names like Nsamanwa. Okay, it creates a very scary presentation of the disease. Okay. And we also have to be very sensitive. These days, there's a whole glossary on language that is used to present diseases. So There's a whole document on how words that are used for diseases like HIV. These days, we don't talk about an HIV sufferer or somebody suffering from HIV. We say people or a person living with HIV, because HIV is a chronic disease. Okay. You have to be very sensitive when it comes to things like gender-based violence. Okay. You have to be very sensitive when it comes to the diseases that have stigma with them. So diseases like Bruley ulcer. You have to be you don't have to be stereotyped, okay? Saying all sorts of scary things about the diseases. We want to avoid any form of stereotype, okay? And we want to balance accuracy with sensitivity. It is always crucial to ensure that the language used does not harm or stigmatize the people and the community where the disease is found and you are reporting. Ethical considerations must always be at the top of whatever we do. Informed consent is always important. Maintaining confidentiality is always important, and making sure that we do not do harm. Now, these days that even with an iPhone, you can film a whole movie. We need to be able to film or do videos, short videos, and help our audience or help the victim, whoever is at the center of the report. You know, I was going to use the word victim and I cut myself short. I don't want to use the word victim because they are not victims. These days, we talk more about clients or people affected rather than use of the words like victims. Nobody is a victim anymore. So we have to be able to identify our clients. Even in the health sector, we are no longer talking about patients. We are talking about clients. We want to be able to identify our clients. We want to be able to identify the people who are affected by the diseases and be able to appropriately report the issues about them without necessarily stigmatizing them or creating a situation where they are negatively affected. We need to be able to contextualize the issue, provide the right context, the pretext, the context, and the post-text, as somebody will say. So we provide the right context within which the issue is happening, explain the social and underlying implications, okay, without stigmatizing anybody. Where there are economic and cultural factors influencing the context, we need to be able to present them dispassionately. You don't present it as if that the people have done so much wrong. Sometimes it is their understanding or their cultural context that influences what they are doing. I mean, in the past when bilharzia was a big disease, in communities that they had bilharzia, they considered passing bloody urine as a rite of passage for men. So in that, if you had to report an issue like that in a community like that, you need to understand their cultural context, where they are coming from, before you present the issue as a health challenge. Other than that, they will fight you. Another example, I had when I was much younger in public health, in med school, when I was first introduced to the concept of public health. There was a malaria campaign program where they went to show a video. Those days when they had all these mobile cinemas. So as part of the educational campaign, they took a mobile cinema to a community where they showed the mosquitoes. I mean, they showed a film of a mosquito, and the mosquito was so huge that the people, when they finished showing the video and they asked the people their impression of the video, what they said was that, as for these big mosquitoes, they don't exist in our community. So the mosquitoes that exist here are the small ones. So we are okay. We are okay with our mosquitoes. They won't give us any problem. So unfortunately, it was because of the context. Whoever was showing the video didn't explain to them that the video is just a magnification of the real situation. So it is always important to be able to understand the context within which the people are operating and be able to explain the context right. And also to avoid oversimplification. Animation, or what you call cartoons, are a very, very good means to tell health information. Unfortunately, if you are not careful, we see in our context in Ghana, people see animation as toys. And so if you send out an animation video to do health information, if you are not careful, it will be wrongly misinterpreted as toys. Toys is for children. So this one, it doesn't affect us as adults. And so it is always very important to understand the context and send the right messaging through the context. We need to be, as we report sensitive health issues, we need to be able to balance public interest and privacy. If somebody is affected, we need to blur their faces. We need to be able to, as much as possible, even change their voices so that they do not end up being stigmatized. I remember I had to do a story about drug-resistant tuberculosis in Ghana. And we had this client who was somewhere in Ashama area. And we needed to, even though the guy was willing to tell the story, we had to ultimately present it such that he did not get stigmatized, because you know TB. Anybody with TB will get kicked out of their house because everybody is afraid that they will end up transmitting TB to them. And so we had to be able to use a subtle means to tell the story. You remember when COVID came, there was a gentleman who, I think he was a clearing agent in Tema. He was one of the first people who got COVID. He later became an ambassador of COVID, and he was talking about his experience with COVID. Do you know what happened to him? Once he started going on air, he said he had a taxi that he was using to, when he didn't have to work as a clearing agent, he had a taxi that he was using to do to make small money to take care of himself. People stopped taking his taxi because they said he will give them COVID. I mean, that's how sensitive our people are. And so when you do health stories, we need to be really mindful of the backlash and how it could affect the people who are in the story. We need to handle visual images responsibly, making where there's a need to blur the faces of the people. Sometimes there's a need to be discreet in showing things like Bruley also saw huge saw on somebody's limb. I mean, we need to be really mindful of how we present some of this. And then always also anticipate the backlash that could occur from some of these stories that we report. Okay. Certain communities may rise up against us and say, why have you gone to report our issue? And it becomes a whole big deal. So we need to be mindful and careful of how we report sensitive health issues. It is always important to do follow-up after we've reported the issue, check with the sources, check on the outcome of the story, and then go back and continuously want to learn. it is important that we do adequate research so that we are able to present the story in the right way. And as journalists, guided by ethics, we adhere to the principles, okay, journalistic principles, and then our ethics in order to present the right information responsibly. Any questions? Okay. If there are no questions, let's move on. Let's move on to the concept of misinformation and disinformation. By definition, misinformation is incorrect or misleading information that is spread without malicious content. You know, these days, sometimes you would... Okay. All right. Question?
Thank you, Doc. Doc, I think that I want to take you back a bit on the issue of evaluation. You mentioned that we should be able to evaluate our stories. And as news agency reporters, how do we do that? Because we have a channel where we write our stories through. It goes to our subscribers and maybe on our website. So in our case, how do we evaluate our stories? For the radio, they are able to make call-ins, allow call-ins and blah, blah, blah. So if you say we should evaluate our stories, what do you do?
Okay, thank you very much. So it is...
Please, we have another...
Okay, okay.
Okay, the second question.
So thank you. I want to ask about the person responsible for our interviews. We do go to programs where you will not see or meet the high personalities or the position holders, but you meet people who have been just selected or sent for to supervise the program. And you ask them questions, and sometimes they answer, other times they will refer you to their superiors. But you end up delaying, they will delay the process, and for you to present your story on time, it doesn't work. Later, your boss will ask, they've done a program last 4 days ago, you are not presenting the story, a whole lot. We want you to, I will want you to tell me what to do in this situation. Thank you.
All right. Thank you very, very much. I think this is a wonderful question. Maybe let me start with that one. That is where building rapport is very, very important. If you build rapport with the people, with the health professionals in your community, you can always go, I mean, it's easier to reach out to them. And when you ask them questions, it's easier for them to answer. If you go to an event, usually there's always the director or the key person or the big man or big woman who has to respond to questions. And I think that one of the good things is for all journalists, when there's an event, all of you to go together to interview the person. Sometimes everybody wants to do their own private interview to sort of be exclusive. But what happens is it also wears the person out. And so you realize that a lot of them, they don't want to answer. They don't want to talk to journalists. And sometimes, in fact, in some certain situations, even me, I've said it before, that sometimes when you talk to the journalists, they don't listen. They pick what they want. They pick the sensational components of what you are telling them. Recently, I mean, that was, I think, either earlier this year or last year, there was a report on, there was a study that was done on MSMs, men who sleep, who have sex with men. Okay. There was a study that was done and it was reported. I mean, there was a dissemination session. Unfortunately, what the information that was presented from the study I wasn't there in that study, but I mean, this is something that was reported to me. But I have a copy of the study report. And the study report shows that we are covering, or we are seeing more people, or the study now covered more people who are MSMs, or in lay language, I don't want to use the word gay, okay, or homosexuals. I mean, yeah, I don't want to use those words. But what is happening, unfortunately, what the reporters went to report was that gay is increasing in Ghana, which is completely wrong from what actually the study talked about. What the study talked about was that more people were covered in the study compared with what happened in previous sessions. And this study is we call it the men's study. It looks at MSMs and female sex workers in Ghana, the coverage or the populations of groupings of these people. So when something like this happens, it presents the wrong picture, and definitely a health professional who presented the study will be so angry that they may not want to talk to a journalist again. Okay, so these are some of the little nuances that tend to affect the way health professionals communicate with journalists. If you build rapport with them, and then you also ask clarifying questions when you're doing the interview, you'll be able to present the story dispassionately. But sometimes there's a bit to want to present the story sensationally. So as much as possible, let's try to avoid the sensation around sensitive issues, especially. On evaluating our story, when you write, especially for those GNA journalists who write stories and you publish them online, you have readers. You know people who read your stories. It is always good to go back to them to find out from them, how did you get the story? How did you see the story that I wrote? Okay. I'm sure you know all the people who read your stories. They could be your friends, they could be your colleagues, they could be lay people. You always find a way to go to them and find out, how did you get the message in the story that I wrote? That is how you evaluate the story. Other than that, it will just be one way. You think you are doing something excellent, but you may not be sharing the information in the right way. I hope I have answered both questions well.
No, we have the third question.
Okay, third question. All right. I'm listening.
Thank you. Mine has to do with communicating complex health information. And one strategy you gave us was using simple languages. And then at the same time, you came back to tell us that we should avoid oversimplification of issues or health issues. So what's the difference between these two? And if you can explain what oversimplification of the issues to us.
Okay,
So,
thank you.
another one.
Yes, another one. Okay.
The Jehovah Witnesses sometimes are stigmatized, especially because they refuse blood transfusion. Indeed, I have written a story about that, and I spoke with some of the health experts. And Doc, they have said that in this aspect, some of them are Jehovah Witnesses, others are not. And they've actually given me an interview, and with documents, said showing that refusing blood transfusion is not ethically and medically wrong, and that there are alternatives even when the person has lost so much blood, there are alternatives. First of all, is that true? Secondly, I would like to know why are we not promoting that and then bringing that into the limelight so that at least most of us who really don't have knowledge about it will know that their action is actually not an evil thing. It is also not ethically and medically wrong. Why are we not promoting it to the rest? Thank you.
All right, thank you very much. So let's start with the communicating. Any additional questions, or that's it?
Okay, we have one more, but she would like to come after. Ada, okay, not a question. No. Thank
you very much, Doc. So the sensitivity in language, we learn from the health, the community. I realized in the United States that, for instance, when someone has HIV, they say that the person has been exposed to the HIV virus, as against ours, which is contracted, which kind of is judgmental, and then so I have expected that maybe over time of the health sector there will be education and upgrading the technologies and then the technologies and information for us to also adjust. That's one. And then secondly, what you said about building relationship, nurturing new sources, so important, and that's what we try to do. But we've also realized that because we have all the patients, I'm talking as news agency journalism, because we are particular for professionalism and ethical practice. So we will send our questions, they will ask us to write letters, and we do all of that. And we will not get the feedback. Rather, sometimes you will see them sitting on radio, on TV or on radio, talking about what we have sent the questions about. They take us for granted because of the familiarity sometimes, and also the patient. So some of the health practitioners or the communicators or the bosses are behaving like politicians, because what our president said as media tyranny. When they call you on radio and you don't respond, they will make fun of you that you are dodging the issues and all of that. So people tend to, rather respond to those doing the wrong things rapidly than those of us who are willing to do the right thing. So in your community, please educate them that they should pay more attention to those who do the right thing so that the breaches will be minimized. Thank you.
Thank you very much. I mean, that's a wonderful question. A very wonderful issue you raised there. My people can be a little complex, okay? People can really be a little complex.